Welcome to YARKUD International. Let's prepare for OMAN PEARSON VUE nursing examination. So today we are going to cover the topic that ethical principle. So ethical principle, we have already seen the autonomy and there will be the beneficent, justice. So all question answer I have discussed. So here we are going to see what is fidelity. Okay, so remaining ethical principle, we will cover it up today. Fidelity, it is remaining loyal and faithful in all the actions and the care. Okay, so you have to remember F, fidelity is called F for faithfulness. Okay, if you're just informing the patient after half an hour, now the time is 11 a.m. So after half an hour, it is 11:30 a.m. I will come and give you the nebulization. So you have to be faithful and you have to give the nebulization at sharply 11:30 a.m. Got the point? This is called fidelity. So if you just getting the situation question like this, so on time faithfulness, it is fidelity. Okay, got the point? So we'll see the next one. It is accountability. The nurses, it is responsible for all our own action. Okay, we are accountable for our errors or mistakes. Okay, so accountability, you have to remember, I am accountable for my own action. So in case the situation like this, the nurse has to be give the medication for the patient at 8 a.m. But he didn't give at 8 a.m. So he honestly and he's taking the responsible and going to the nurse manager and informing that I didn't give the patient 8 a.m. medication, so that they will go and inform to the doctor and whatever the patient problem, they will be solved. So nurse take the accountable and he just inform the mistake. Okay. So accountable for their own action. It is come under accountability. Got the point? Okay, let's see the next one. Non-maleficence. What is non-maleficent? Okay, maleficent means it is bad. Okay, what is non? It is no. So no bad to the patient. It is called do no harm to the patient. Okay, so intentionally or unintentionally, we should not do any harm to the patient. Okay, that is called under non-maleficent. Okay, during the procedure or during the any surgery or anything, we should not do any harm to the patient. That is called non-maleficent. If it is harm, that means the non-maleficent is violated. Got the point? Okay. So let's see the next question. Okay, next topic is veracity. What is veracity? V for remember, it is very honest. Okay, I'm giving all key points so that any question from ethical principle, you can easily answer it. So veracity, it is entirely honest with the patient at all the time. Okay, so anything. So if you are going to give the medication, so if this is a side effect of medications, you have to inform to the patient very honestly. So that is under the veracity. Okay, very honest to the patient. So if you just do this, it will be happen like this. So you have just explaining very honestly, that is mean it is veracity. Got the point? Okay, let's see the next one. Okay, so these are the ethical principles. So I am summarizing this. So any question from ethical principle, you can easily answer because in OMAN PEARSON VUE examination, there is a 20% of question from this nursing fundamental leadership and ethical principles. So you have to concentrate and study well for to cover the ethical principle. Have given all the examples so that you can easily answer it. So what is autonomy? Just remember the key points. Autonomy, it is the right to do is our own decision. In the treatment plan, anything, the patient has the right to do her own decision. Okay, no, so rights to refuse also. You have to think that. Okay, beneficial, what you have to remember, it is doing right and doing good to the patient. Okay, benefit, it is good. Okay, got the point? What is fidelity? F stands for faithfulness, remaining loyal and faithful. That is called fidelity. What is accountability? We have seen already. Accountable for all my action, whatever I am doing. Okay, what is justice? It is fair. Just means it is fair to the patient, equally carrying all the patient. Okay. What is non-maleficence? No harm. Okay, no bad to the patient, no harm to the patient. Okay, what is veracity? V for very honest. Okay, so remaining honest at all time. Okay, this is called the veracity. So these are the ethical principles. So we have seen all the ethical principles. Let's see one last question so that you can be able to answer it. Not we will see. Okay, a patient wants a fractured tooth. Okay, wants the fractured tooth extractor. So dentist tells the patient that the fractured tooth is restorable. What two ethical principles are in conflict here? Okay, there is two ethical principle inside this. What does that do? So you have to take the key point first. Okay, so first one, patient wants. That means the autonomy of the patient. Patient wish. Okay, so patient is wish to extract the tooth. So it is autonomy is here. Got the point? Second thing, the dentist telling it is restorable, doing good to the patient, benefit to the patient. That is what? Beneficent. So what is the two principle here? The answer is beneficent and autonomous. Got the point? Okay, this is the way of answering. So you have to take all the key points and answer it correctly. Okay. So these all the ethical principle topic. So any question from ethical principle, you can use this key points and write it out. Okay. So here the YARKUD International, we are giving the online training for Promotric, SNP, MOH, DHA, HAD, OET, IELTS, and OMAN PEARSON VUE examination. Any nursing examination coaching, you can contact YARKUD International.